myself and 5 other individuals got together in September and started brainstorming where we would have this clinic, who would be there to advise us, how many patients we would take on. So we approached Dr. Shelov, and he was completely supportive of the idea of creating this clinic.
We work with an organization called Rotacare in their clinic on Sundays. They're the local Long Island Rotary Club.
We really wanted to have a West Campus student-run free clinic. So I was looking at SB Home at the time and wanted to have something similar. The board of directors of Rotacare and senior administration at Winthrop Hospital had gotten together and gave us an opportunity here to expand Rotacare on Sundays, which became the WiSH Clinic.
They let us use their space on the weekends, and they run the clinic every week, Monday through Friday. And they take care of scheduling patients for us. They look at lab results that came back, and they have an established clinic that we are fortunate enough to be able to utilize on the weekend to see these patients.
It really gives me the time to work with all of the students. It gives me the time to work on a one-on-one basis, and in our busy offices during family medicine, during the ambulatory, now called primary care, really don't have the time to sit and work with each individual patient and take the time that it is necessary for teaching.
I love volunteering at WiSH because the patients really become your own. It's kind of like you're at your own practice, and it's really nice to be able to see a patient come in and recognize you and thank you at the end of each visit. And on top of all of that, you get to help an underserved population, the people who sometimes really need the healthcare the most, and you end up being a vital part of their healthcare.
I want to highlight that the biggest factor for me why I volunteer at WiSH is because continuity. You see the patient in January, let's say. You met the patient for the first time and you diagnose them with something. You get to come back in February and see them again after you started them on a treatment or you sent some labs. You get to figure out, are they losing weight? Are their blood sugars coming down? Is the medication that you started them on working? So I think being able to cater to that aspect of medicine and you being the mini doctor in this stage of your medical student education, I think that's the great part.
So I also like the fact that the WiSH Clinic is a bit slower paced, but it does allow room for teaching and discussing, and that was something that I really enjoyed as well. The fourth year medical students and also the attending just kind of guide you, but also give you some independence for you to develop your own clinical skills.
WiSH Clinic is great because it's a 10-minute drive from Winthrop. We're able to take the time to do a comprehensive history, and we're also able to practice physical exam skills, like taking vitals, checking finger sticks, doing HbA1cs, and we're also able to help with doing EKGs. And so we're really given a really great opportunity to practice with attendings and teach each other.
So the reason I wanted to volunteer at WiSH because I got the opportunity to do so in the summer, and I was able to see the difference that WiSH Clinic is making in the community.
I think we have the unique opportunity to really impact a group of patients that, unfortunately would struggle to really get decent access to medical care.
Here I am, I'm worried about my step 2, I'm worried about applying, and I see these patients that don't have much or anything, and it just puts things in perspective that life is really good for me right now, and it's nice to be able to help them because they're so appreciative, and to see them come back month after month really makes me feel good.